There is no histopathology laboratory in the entire Bono region. Health facilities in the 12 municipal and district assemblies in the region who suspect a cancer case and need to confirm it have to send a sample to the Komfanochi Teaching Hospital for diagnosis and confirmation. This at times delays the treatment process of patients when the cases are positive, as it takes some time for the results to be produced. However, to improve early detection and treatment of cancers, the management of the SDA Hospital in Sunyani has initiated steps to establish the first ever histopathology laboratory in the Bono region. When the facility is completed and becomes fully operational, it will improve healthcare delivery in the Bono region, as it will reduce the number of times people have to travel to Kumasi to get tested. Medical Director at the SDA Hospital, Dr. Philiphobi Kakari, has been speaking on the establishment of the laboratory.
Yes, if you look at the theme for this year, it's early detection and effective treatment. Early detection means that the detection starts from the examination, history examination. You can do all the scans, but essentially for you to see whether the thing is malignant, which is the cancer, or it's not malignant, you have to take the biopsy, then do a histopathology, then you know. As it stands right now, we take all our samples in the whole region to Kumasi. Then they will write a report for us to know whether it's cancerous or not. Then we can start the treatment. So it takes time. So it wastes the patient's time. So that is not early detection. So the goal is that we want to get to early detection so that the mortality and morbidity of breast cancers will go down.
Eric Taousu, a diagnostic pathologist at the facility, throws more light on what will be done at the facility.
100% of confirmatory cancer diagnosis is done in a histology or histopathology lab. So you might suspect it, but to be 100% sure that whatever you are seeing is cancer, you need a histology lab or histopathology lab to confirm it for you. So when the whole lab is complete, the test that we are supposed to run here is the histology, or what we call histopathology. So any sample, whether it's breast, prostate, bowel, any tissue that you take in the body that you suspect that this tissue can be cancer, is supposed to come to the histology lab, and then we'll confirm whether it is cancer or it is not.
Health focal person for the Ghana Health Service in the Bono region, Nanama, has commended the authorities at the SDA Hospital for the steps they've taken in establishing a histopathology laboratory.
The SDA is putting up a histopathology lab which is going to diagnose all cancer cases, and especially the breast cancers. And it's really going to help women in Bono, because in the whole region we don't have such a facility. And then when the women come and we suspect, we refer them to Komfanochi to go for the diagnosis over there, which is a lot of hectic, because going for a car from here to Kumasi to Komfanochi, the stress the women goes through before the diagnosis. So when we have this facility here, it's really going to relieve us. And when somebody come and you suspect and the facility is here, the person will just go. Even most of the women that we suspect, most of them don't go, that we refer to Komfanochi. They don't go. So when they think that they are going to pass through all this stress, they go back home and then go for the orthodox medicines, the herbs, and they use it. And they only come back when they are at the terminal stage. So it's really going to help us, and we are so happy that SD Hospital is going to be the first hospital to come up with this histopathology lab.
From the histopathology laboratory at the SDA Hospital in Sunyani, I am Michael Saponinfum for Citi News.